Hey, this is Dr. BenWeitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, I'm excited to be having a discussion on hyperthyroidism with Dr. EricOsansky. We have had a number of discussions on this podcast about hypothyroidism or Hashimoto's thyroiditis, which is an underactive, sluggish thyroid, the most common thyroid disorder, the most common autoimmune disorder. But some patients have an overactive thyroid, which we refer to as hyperthyroidism. And like hypothyroid, most patients, it's an autoimmune condition. But unlike hypothyroidism, when the body doesn't make enough thyroid hormone, in hyperthyroidism, or Graves' disease, which is the autoimmune version of it, the thyroid makes too much thyroid hormone, which means it's speeding up the metabolism. And there's a series of symptoms that are related to having too much thyroid. Patients sometimes lose weight. Though, interestingly, there's patients who have trouble losing weight who have hyperthyroid. I find that interesting. Sometimes they have tremors or rapid heart rate, anxiety, a bunch of symptoms. And not many functional medicine practitioners really talk about hyperthyroid. So Dr. EricOsansky is really the go-to guy about this topic. Dr. Osansky is a chiropractor and one of the leading experts on hyperthyroid. He was personally diagnosed with autoimmune hyperthyroid, also known as Graves' disease, and he was able to overcome it using a natural functional medicine approach. He avoided both the prescription anti-thyroid medications and the radioactive iodine treatment, as well as thyroid surgery. Dr. Osansky has a Master's of Science degree in human nutrition and functional medicine. He's a certified clinical nutritionist, a certified functional medicine practitioner. And Dr. Osansky has published 3 books, Natural Treatment Solutions for Hyperthyroidism and Graves' disease, which is currently in its 3rd edition, Hashimoto's Triggers, and the Hyperthyroid Healing Diet. Dr. Osansky, thank you so much for joining us today.
Dr. Ben, thanks for having me. Really excited to talk about hyperthyroidism and Graves' disease.
So let's get right into it. What is hyperthyroidism? What is Graves' disease? And what are some of the consequences of having this condition?
Yeah, well, you gave a little bit of an overview. So hyperthyroidism is when you have too much thyroid hormone, and the main thyroid hormones are T4 and T3, at least the ones that can be measured on a blood test. So you have too much T4, T3. You also have what's called thyroid stimulating hormone, or TSH. So like you said, hypothyroidism is a lot more common. And when you see hypothyroidism, usually the first signs that doctors at least look at is that first marker is that TSH, and they see the TSH on elevated, and then that's when they might do other tests like a T4, T3, then maybe antibodies. With hyperthyroidism, it's the opposite. So thyroid stimulating hormone stimulates the thyroid gland to produce more thyroid hormone in the case of hypothyroidism. But with hyperthyroidism, since you have too much thyroid hormone, you want to have low levels of TSH. The pituitary gland does not want to tell the thyroid gland to produce more thyroid hormone. It wants to do the opposite. So usually you have not only low levels of TSH, but undetectable levels of TSH. So you have that low TSH, elevated thyroid hormones. And you mentioned some of the symptoms. When you have too much thyroid hormone, you could have rapid heart rate, you could have heart palpitations, tremors, anxiety, which can cause insomnia. You mentioned weight loss. You are right that not everybody with hyperthyroidism lose weight. But when I dealt with Graves, I lost 42 pounds, and I wasn't trying to lose that much. I was 182 at the time and went down to 140. So my normal is like 165, 170. And so, yeah, I definitely lost a good amount of weight. And some people also have what's called thyroid eye disease, which is also it's associated with Graves, the same autoimmune component that causes.
So
Graves.
what is this thyroid eye disease? Maybe you could talk about that for a minute, because that can be a very serious condition, correct?
Yeah. Oh, yeah. So with Graves, you have what's called thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody, and those TSI, the thyroid stimulating immunoglobulins, attack the TSH receptors of the thyroid gland or bind to the TSH receptors, and that's what causes the excess production of thyroid hormone. But those same antibodies could also attack the tissues of the eyes, and that could cause bulging of the eyes, swelling. In some cases, it could cause double vision. And you're right, it could be serious in some cases. I mean, thankfully, only about 3 to 5% of cases of thyroid eye disease is severe. Usually it's even when it's not severe, it could be pretty, like if someone has bulging of the eyes, it's, very distressing, but then also it could be very uncomfortable as well. So yeah, like we got what Graves is, of course, more of an immune system condition than a thyroid condition. And so thyroid eye disease, similar, it's more of an immune system condition. It involves the eyes, but you need to address the immune system. Ultimately, when addressing the cause of the problem, when you go to conventional medical doctors, they'll try to address it in other ways. They'll suppress the immune system with things like prednisone. Sometimes they'll have to do surgery with thyroid eye disease. And there's also, I don't know if you're familiar with the medication Tepezza.
Yes, I've heard of that.
With the infusions, they give infusions like 3 weeks apart, every 8 weeks, and that, I mean, it's effective, but especially with bulging, the problem with Tepezza, it could also sometimes cause hearing loss or tinnitus, which obviously is not fun. So yeah. So anyway, I'm not saying there's not a time and place for.
If you want to see better, you can't hear.
Yeah, exactly. So, yeah. And, to be fair, I can't say I have a lot of people who've taken the Tepezza, but I've had a few, probably like maybe at this point, maybe 5 or so. And one person, a male patient, did lose his hearing. It was temporary for a few, but still kind of scary when you lose your hearing because you don't know if and when it'll come back. And then,
right.
But I've had in that same person where he lost the hearing, it did help with the bulging. And then a few other people have taken it. It also helped with the bulging. Doesn't seem like it helps much with double vision, but for bulging, it could be life-changing for some people. It's just a matter, are you willing to take the risks with not just the hearing loss or the tinnitus, but it is fairly new. So we don't know like side effects like 10, 15, 20 years down the road.
Right.
Yeah.
So when it comes to labs for hyperthyroidism, what level TSH do you think is definitive? I've seen 0.5, 0.4. You mentioned that maybe it should be undetectable. What's your take on that?
Definitive, you meaning what's considered
for diagnosing hyperthyroid? Yeah.
Yeah, it's a good question. I mean, obviously, if it's undetectable and the thyroid hormones are elevated, then that's clearly hyperthyroidism. When you see TSH, let's say of like 0.3 or 0.4, like below the range, or again, maybe 0.5, 0.6, maybe like on the lower side, like on not like within the range sometimes, but on the lower side. But many times that's more subclinical. Like many times when we see that TSH, like 0.3, 0.4, 0.5, we'll still see the thyroid hormones within the lab range. And so, yeah, I mean, if it's below the range, it's considered to be subclinical hyperthyroidism assuming the thyroid hormone levels are normal. And if someone has low TSH, even if it's not undetectable, and thyroid hormones are normal, you could also have subclinical Graves' disease where you still have those antibodies. And not common. I've had a few patients with that. Typically, when you have the Graves antibodies, usually it's overt hyperthyroidism, not subclinical. But yeah, I mean, I don't know. I guess if it's zero point 0.3, zero point 0.4, I mean, I still consider it hyperthyroidism. But it also depends. I mean, there could be, maybe there's something else underlying. I mean, but it's not normal. Let's put it that way. If someone comes in with, a TSH zero point 0.3, zero point 0.4, especially if it's been like that for many months or many years, and doctors just kind of dismiss it and say, oh, don't worry about it. Your thyroid hormones are looking good. And maybe they tested for the antibodies for Graves and everything looks good there. To me, there's still an underlying cause, but it is a little bit more challenging, honestly. Like you would think Graves is more challenging because it's autoimmune, but at least we know it's Graves and there's that autoimmune component. And when it's subclinical hyperthyroidism, sometimes it can be more challenging to get that TSH up naturally. If you take anti-thyroid medication, that'll drive it up, but that's not addressing the cause. So as soon as you stop the anti-thyroid medication like methimazole, it's going to go back to where it was usually.
Right. Now, during pregnancy, a lower level of TSH is considered acceptable, right?
Yeah, I mean, if you're pregnant, if someone's pregnant, then yeah, having that, if the TSH is, again, it's typically shouldn't be like undetectable, but it depends. Sometimes we'll see TSH a little bit higher because there's more demand for thyroid hormone from the baby too. So it really depends. Yeah.
And what about level of free T3 and free T4 for being able to diagnose hyperthyroidism?
Yeah, well, according to like United States values, I consider an optimal T4, free T4 to be between 1 and 1.5, and optimal free T3 to be like between 3 and 3.5. Now, that being said, if someone has like a free T4 of like 1.6 and a free T3 of like 3.7, that's usually still within the lab reference range, depending on because as you know, different labs use a different reference range. But most of the time, it'll be within the range. But then again, that sometimes that's high enough to put the TSH lower or even undetectable. But yeah, again, to me, I still would consider it more subclinical at those levels. But again, still, it's worth looking at because everybody's different. Some people, it happens really quick where their thyroid hormones shoot up, TSH, gets depressed pretty quickly. Other times it might start out as subclinical and then maybe a few months it kind of turns into full-blown Graves. So unlike medical doctors, we don't want to play the waiting game and just say, we want to look at antibodies in that situation, just make sure that they don't have thyroid antibodies and that we don't have to start working on the autoimmune component.
Right. So that's where you're looking at TSI, and sometimes patients with Graves also have elevated TPO antibodies as well.
Pretty common. The research shows between 60 and 80% of people with Graves have elevated TPO antibodies. And I think Hashimoto's, it's like 90%. And
now, why would they have some of the same antibodies as patients with Hashimoto's?
Yeah, it's a good question. Some people have all three antibodies. So why is that? Like when I dealt with Graves, I just had TSI. I didn't have TPO antibodies or thyroglobulin antibodies. A lot of people have TSI and TPO, and then I'd say probably like 20 to 30% have all three antibodies. So why is that? Why do some people have one, others have two, others have all three? There's, as you know, if you have one autoimmune condition, you're more likely to have multiple autoimmune conditions. And even though all three of those are thyroid antibodies, they're different thyroid, they're attacking different parts, like the immune system is attacking different parts of the thyroid gland in all three situations. So similar where you could have those thyroid antibodies and then you could have other auto antibodies associated with other autoimmune conditions. So there are different, and there could be overlap of triggers, but there could also be different triggers. And I think that's why sometimes, let's say if we have someone who has all three antibodies, and in a perfect world, when trying to address the root cause of the condition, will want to see the antibodies decrease and normalize, which is easier said than done. Sometimes it could drive you crazy trying to normalize them, but it's not uncommon to see, like, let's say TSI eventually normalize, but then maybe TPO and or thyroglobulin still remain elevated. And so there might be, and usually there are multiple triggers. Like I said, the same thing with other autoimmune conditions. So if you have other auto antibodies, it's just that, again, it could be potentially one trigger causing all the different autoimmune conditions. It could be multiple triggers. And usually is multiple triggers. And then according to that triad of autoimmunity or three-legged stool of autoimmunity, you also have that leaky gut component that's also playing a role. But then also there's genetics too. So like really, why does someone develop celiac disease instead of Hashimoto's, or someone develops both Hashimoto's and celiac disease, or a Graves' disease, Hashimoto's and celiac disease? Again, it's a combination of genetics, environmental factors that increase in intestinal permeability. So that's that triad of autoimmunity.
So when a patient goes to see a conventional endocrinologist for Graves' disease, what are the most common treatments?
Yeah, it's pretty much three treatments for the most part. One is medication, anti-thyroid medication. Methimazole is or Tapazole, the most common anti-thyroid medication given. Sometimes is also what's called propylthiouracil, or PTU. That's something, especially if someone is pregnant, like the first trimester of pregnancy, they're usually given PTU, or they can't tolerate the methimazole. Many times they can't tolerate the PTU either, but sometimes they can. So usually the anti-thyroid medication, some people are also on beta blockers. Certain beta blockers like propranolol affect that, it inhibits the T4 to T3 conversion. And then number two, radioactive iodine, which pretty much using radiation to destroy the cells of the thyroid gland, and usually making someone hypo. Not all the time though. Some people need multiple treatments. If they get like one treatment with radioactive iodine, they might still remain hyper if the doctor used a lower dose. And then the third option, thyroid surgery. It's usually complete thyroidectomy. And the great thing about that, it does cure the hyperthyroidism, but the bad thing is that two bad things. One, you do need to take thyroid hormone the rest of your life, which again, some people do need to do that, but probably the worst thing is that you're not doing anything for the autoimmune component of Graves, because again, it's more, as we discussed, more of an immune system condition. So you're still at risk of developing other autoimmune conditions in the future with really any of those three methods. But unfortunately, with radioactive iodine surgery, most medical doctors just say that's the cure, and now you're good to go. Just take thyroid hormone the rest of your life, all is well. And yeah, unfortunately, that's not always the case. Some people do well, with surgery. Some people do okay with radioactive iodine, but many people don't do well. And you just don't know with any procedure, obviously with that, you just don't know. So of course I'm going to be biased and say, always try to address the cause of the problem. You could always get surgery. You could always get radioactive iodine, but once you get either one of those, you can't undo that. You can't turn back time.
Yeah, interestingly, the second and third treatments, you mentioned the radioactive iodine and the removal of the thyroid gland, it would be the same treatment as if you had thyroid cancer. Mm-hmm. So in no way is it really fixing anything. It's just correcting some of the symptoms. Now, from a functional medicine perspective, we want to ask, what has gone wrong that your immune system now is attacking yourself, whereas your immune system is supposed to just attack foreign invaders like bacteria and viruses and things like that, help with wound healing. But somehow the immune system now is attacking your thyroid gland. And what's gone wrong that your body is not doing the right thing?
Yeah, another great question. And we're still obviously learning about autoimmunity. We have a lot of answers, but we still don't have all of the answers. But there's a lot of things that can cause the immune system to go haywire. We we definitely live in a more toxic world than we have, for the last like 10, 15, 20 years compared to 50 years ago. I mean, and it's getting worse and worse. All these chemicals, I mean, the xenoestrogens, the microplastics, the glyphosate, I mean, they could, some of these can affect the thyroid directly and like as endocrine disrupting chemicals. But as far as the autoimmune component, they also could affect the immune system. And many of these, we know glyphosate disrupts the gut microbiome. We know that microplastics also affect the gut microbiome, and nanoplastics, and even heavy metals affect the gut microbiome, which again, I didn't know until a few years ago. I knew that they have negative effects on the immune system, and mercury could affect the thyroid, but a lot of these things affect the gut. And we're just learning a lot more. I mean, you really didn't hear a lot about gut microbiome like 10 years ago, compared to today. Like there's so much research. If you just go on PubMed, it's just amazing how much research. And now they're really, I mean, even I guess 10 years ago, I mean, I went through the Institute of Functional Medicine training. I mean, I started that in 2014. And even back then they were talking about the gut, but again, it's just exploded compared to then. And so a lot of these chemicals affect the gut, the foods, which relate to again, a lot of chemicals in the food, the glyphosate, and the pesticides, and just, and then of course, a lot of controversy with the gluten. And then there's talks about molecular mimicry when it comes to
that's the main mechanism that we currently understand as the reason why the immune system now starts attacking yourself, because it recognizes yourself as foreign.
Exactly.
Because you have antibodies, say, to a virus, and then there's protein structures in the body, say in the thyroid gland or somewhere else, that are similar to what the antibodies are attacking.
Exactly. Yeah. But, again, I think about infections like viruses, bacteria. I mean, they've been around for a long time, at least things like Epstein-Barr, and H. pylori, which have been associated with Graves. But like I said, the toxins are something different. Even the gluten now is like different compared to many years ago. I think that's the big difference. Like the infections are definitely a factor. I mean, when during the pandemic, we definitely had an influx of people who got COVID.
There's no doubt that one of the things that COVID did is help reactivate other viruses like Epstein-Barr. And Dr. Vashtani has published a study showing that the COVID virus is one of the most autoimmune reactive viruses we've ever had, or perhaps the most. So unfortunately, this virus infection that affected the whole world is liable to lead to an increase in autoimmunity.
Yeah. Yep. I agree. And definitely have seen that.
So among the possible triggers, one of the triggers for hypothyroid is iodine. And we saw across the United States, there used to be high rates of a thyroid condition known as goiter, where the thyroid would become enlarged, and that was because of a lack of iodine. So in order to address that, the United States and a lot of other countries started adding salt to the diet. In the United States, we did it particularly with, we added not salt, we added iodine to the diet. And in the United States, we did it by adding iodine to the salt.
Iodized salt, yeah.
And we still have iodized salt. And what happened is rates of goiter went way down, but rates of autoimmune thyroid went way up. And we see that excess iodine induces an inflammatory response in the thyroid, which is critical for the development of thyroid autoantibodies. Does this also play a role in hyperthyroid?
It can, yeah. I definitely have people that start working with me, and that was supposedly the trigger, or at least like the straw that broke the camel's back, where, that's where it changed, where they started taking, let's say, high dose iodine supplements that maybe they read a book somewhere or watched some videos and heard that it's actually good for beneficial for thyroid health. Because it's there, like 10, 15 years. I forgot when Dr. David Brownstein came out with his book, Iodine, Why You Need It, Why You Can't Live Without It.
Right.
But, I know it was before I was diagnosed with Graves in 2008, and I'm pretty sure it was before then. I interviewed Brownstein on, not the podcast, but on just before I had a podcast, the blog, and that came out in 2010. So anyway, so his book's been out for a long time. And prior to my Graves' disease diagnosis, they were encouraging not only people with Hashimoto's, but with hyperthyroidism Graves to supplement with iodine, or maybe do urinary iodine test. And again, based on Brownstein's findings. And
this is very
Abraham,
high dosages of iodine.
Exactly. Yeah, exactly. Like 25, 50, not micrograms, but milligrams of potassium iodide. And I'll be honest, when years ago, when I was dealing with Graves, I took, I just, because that's what they were teaching, when going through like standard process seminars, for example, and they're well known, and just like, and it wasn't just the companies, but the people who were teaching were, it wasn't until, if you're familiar with Dr. Datis Karazian, and he came out with his book in 2010 or 2011, and then, he was more talking about the problem, the iodine controversy. And up until then, and it's not like I was taking high dose iodine for years, but I took it for a few months, not 50 milligrams, but about 25 milligrams. And honestly, I did fine. Like it's not like it was, this was after dealing with Graves. So it's not like it triggered the Graves, and it didn't seem to make things worse in my situation. I was doing a lot of other things too. But for probably like a couple of years, I was recommending iodine, to my patients also, like, just because that's what I was taught. And that's
sure.
So let's do an iodine loading test. And then most people would show up deficient with that. And so let's put them on an iodine protocol. And then, I realized, I did start realizing that some people didn't do well with iodine, and sometimes it could be a potential trigger. And again, it could be, not obvious until you look at the antibodies and you see the antibodies shooting up. But then there are some cases, I remember, and thankfully this person wasn't my patient, not that it made me feel any better, but I remember a person emailing me and just like saying, just like she randomly took iodine and it really like flared up her thyroid eye disease symptoms. And just I would have felt really bad if it was if I recommended that to a patient and they did it based on my recommendations. I still felt bad for this person. But I have seen people get worse with iodine.
Yeah, I have Hashimoto's, and my TSH was like around 7, and it went up to 9. So I thought, let me try this high dose iodine. And I took the 12.5 milligrams, and it shot up to 25. So I had to get off.
And they'll say, if you read like the Brownstein's book and dive into, I guess, their research, they'll say that the increased TSH is common when you supplement with iodine. But I think the big concern is, how is it affecting the autoimmune component? Because that's what Dr. Karazian talks about, not necessarily just the impact on the thyroid, but is it actually, like you said, a trigger, like an autoimmune trigger? And then with hyperthyroidism, when you think about it, you need iodine to produce more thyroid hormone. Now, if you take it in high doses, sometimes it could have the opposite effect. It could have like a suppressive effect, but it could also, in some cases, exacerbate the hyperthyroidism, or in some cases where people were taking it and they weren't hyper to begin with, and then they see me because they were, that's what they were doing. They were taking the high dose iodine and became hyper upon, the high dose supplementation.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration. And it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code Weitz, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code Weitz today. And now back to our discussion. So let's get into your natural treatment. Should we start with diet first? What do you want to start with?
Yeah, that's fine. Let's go. I mean, I always like starting with the foundation. So like diet, stress management, sleep. So yeah, we definitely could start there.
So what are the foundations of a good therapeutic diet for somebody with hyperthyroid?
Yeah, great question. So the hyperthyroid healing diet, it's a little bit misleading because when someone looks at the title, they might get the impression there's like a single diet for hyperthyroidism, but I actually talk about 3 different diets because there's really not one diet for everyone. And I mean, one could argue there's not just 3 diets either that's in the book, but so the first, so you're familiar, I'm sure, with autoimmune paleo, like autoimmune protocol.
Yeah.
So in my book, I have like level 3, which is like a modified AIP diet, level 2, which is a modified paleo diet, and then level 1, which I don't know if you're familiar with Dr. Stephen Gundry's work, which the plant paradox. Right. So it's like kind of like a modified plant paradox diet. And so if like for Graves, I do recommend either like a level 2 or level 3 diet. Like if someone finds an AIP diet too challenging, because it is pretty restrictive, then I recommend just at the very least like a paleo diet while healing. It doesn't mean like a permanent diet. And the purpose behind these diets is, obviously with any diet you want to avoid refined foods and sugars. You want to avoid fast food, but with AIP also, and then, the common allergens like gluten, dairy, with both paleo and AIP, you avoid grains because they could be harsh on the gut, even like even the gluten-free grains. Nightshades also are excluded. It's almost like an elimination diet. I mean, you could say, well, not there are health benefits to nightshades. Eggs are excluded, and there's definitely, I eat eggs, like there's health benefits to eggs, but just like even a lot of regular elimination diets will avoid, maybe not so much the nightshades, but eggs is considered like a common allergen. So it's really just avoiding common allergens as well as foods that could potentially affect the healing of the gut, since you have that leaky gut component. And then, like I said, with any healthy diet, you're going to want to avoid the refined foods, the sugars, unhealthy oils, and all that stuff. But yeah, so I usually lead people more towards the level 3 or like AIP type diet. But again, if they're not, for those with Graves, if they find it too restrictive, then like a paleo diet. But if someone's a vegan vegetarian, they might find even a paleo diet to be really difficult to follow, especially if they're vegan and with paleo, it allows eggs, but if you're vegan, you can't even eat eggs. So with level 1 or a modified plant paradox diet, that does allow like pressure cooked legumes as like a source of protein, and just, it does allow some more flexibility.
Do you purposely have patients consume goitrogenic foods like broccoli that some people feel inhibit thyroid production?
I have in the past. I didn't find it to work. It's like years ago, I've had pregnant, like, because women who are pregnant who see me, usually if they're looking to take a natural approach, they don't want to take the medication during pregnancy, which I don't tell them not to take it. But if they refuse to take it, it's not good to have unmanaged hyperthyroidism. So, years ago, what I did is I had like pregnant women eat large amounts of cruciferous vegetables like broccoli, for example, seeing if that would suppress thyroid hormone. And I really didn't see that. I mean, unfortunately, because it would be great. Just take eat a lot of broccoli and kale and cabbage, Brussels sprouts, and don't have to worry about taking the anti-thyroid medication. But I just didn't see it really being effective.
So what are some of the other components of your integrative functional medicine approach to hyperthyroidism?
Yeah. So, stress management. So again, diet and lifestyle. We spoke about diet, stress, huge, not just emotional stressors, but physical stressors, overtraining, which I was guilty of when I was prior to my Graves' disease diagnosis. So most people I work with, they have chronic stress components. How do
you address that?
Yeah, well, first of all, I like to test for adrenals. And the reason I like to test for adrenals is with my story, I knew stress was a factor, but I was in denial that I thought I was doing a good job of handling it. So I was like, yeah, I know stress is a factor. I just could handle it good. But then I did my adrenals and I saw that was my adrenals were shot. My cortisol was low. My DHEA was low. Secretory IgA was low. Pretty much everything was low. And that convinced me that, okay, now I see my adrenals are a mess and I need to improve it. And then I could also retest, which I did a few months later to see the improvement. So I know not every practitioner likes doing adrenal testing, but I do like either doing an adrenal saliva test or like a Dutch test that also looks at the adrenals as well as the sex hormones and
which company are you using for your adrenal testing most of the time?
Usually I use Diagnostics.
Okay.
Yeah. I mean, if I'm working with someone internationally, I might use Genova, their adrenal saliva test. Like if someone's in the UK, they don't have access to like Diagnostics. So, there's other ZRT is really good. I mean, there's a number of good saliva tests.
What are some of your favorite go-to supplements for patients who have decreased adrenal function? Like you said, your adrenals were in the toilet.
Yeah. Licorice root. Which you got to be careful if you have high blood pressure. Licorice root can increase blood pressure.
And for this purpose, you don't want to use deglycerinized licorice.
Exactly. Yeah, the DGL licorice is good for gut mucosa, for the gut lining. But yeah, you want to use just the regular licorice root for low cortisol. So yeah, I'm glad you brought that up. And then B vitamins, like a B complex, typically, sometimes an adrenal glandular for support as well. And I mean, there's some really good herbs. One thing you might find, I mean, you probably already know, but if not, or your audience doesn't know, ashwagandha, which is commonly used for adrenal function, there's some controversy with ashwagandha and hyperthyroidism because it could also stimulate not only the HPA axis, but the HPT axis, the hypothalamic pituitary thyroid axis. And in some people, it'll cause mild hyperthyroidism. So people got to be careful. I love ashwagandha, and I'm not saying I never give it, but if you take like a separate ashwagandha supplement that has like 500 milligrams of ashwagandha, you're at a greater risk of developing hyperthyroidism. Now, the thing is with ashwagandha, like if
you mean because it stimulates so much thyroid production?
Well, it stimulates the HPT axis, like the hypothalamus pituitary, which communicates to the thyroid. And yes, so essentially you're getting some extra production of thyroid hormone. But once you stop it, it does seem like it stops. And I bring that up because with iodine, sometimes it doesn't stop. Like someone might take like high dose iodine, and it might induce hyperthyroidism. And then, okay, I'm going to stop the high dose iodine, but the hyperthyroidism persists so it's definitely not the same mechanism as that. But then also ashwagandha is a member of the nightshade family. So if someone is following AIP,
Right.
they probably want to also avoid it if they're trying to strictly avoid AIP. But so I usually don't give ashwagandha specifically, but there are other herbs. Rhodiola is really a good herb for adrenal support. Romania, you don't hear as much about that, but that's also a good herb. Holy basil. So those are some of the support I would give for low cortisol.
And then we have gut health.
Yep. So gut health, we spoke a little bit earlier about the problems with everything disrupting the gut microbiome. So probably the number one thing is to try to avoid those factors. There's the 5R protocol. So remove, replace, repair, replace, reinoculate, repair, rebalance. So that remove component, you want to remove gluten since it could cause the leaky gut. We spoke about glyphosate, which try to minimize glyphosate since it can cause gut dysbiosis. And, if you have gut infections, which again, a lot of controversy with H. pylori. Some don't even consider it a gut infection. Some say, well, H. pylori is, normal. Same thing with parasites. A lot of controversy with parasites, but you want to remove the factor or factors that's disrupting the gut, and then replace things like digestive enzymes. If someone has low stomach acid, address that, like whether it's betaine HCl or bitter herbs. Reinoculate, prebiotics, probiotics, repair, drinking things like bone broth or cabbage juice if you're a vegan vegetarian, and then of course L-glutamine, aloe vera, zinc carnosine, things that could support the gut, DGL licorice, which we mentioned earlier. And then the last are rebalance. So rebalance the adrenals, the nervous system, the parasympathetic nervous system. So in a nutshell, it's not as easy as it sounds, but yeah, just the biggest thing is like there's so many things that are disrupting the gut. So we obviously want to do things to help repair it, but we can't repair it if we're constantly being exposed to these factors.
Right. So you mentioned toxins. How do we address toxins?
Yeah, that's a big challenge. In our homes is where we could do the most. Like once we step outside of our house, we can't really do too much. But in our home, we could, again, buy organic food. We could use natural cleaners and cosmetics. We could get a water purifier. We could get an air purifier. So really just, I would say, try to do as much as you can in your own home. And then you could do things to support detoxification. Eating, we mentioned cruciferous vegetables are actually good for supporting the detox pathways, obviously staying hydrated as well. And then there's time and place for supplementation, things like N-acetylcysteine or liposomal glutathione, even milk thistle, and then sauna. I do sauna. Now sauna, I'll say this, I do sauna like 2 or 3 times a week. If you're hyper, you want to be careful because if you're in the sauna, it's going to raise your heart rate. And so if you have unmanaged hyperthyroidism, especially like if you're in the process of trying to get those thyroid hormone levels down and you have a heart rate of 100 beats per minute or higher, you probably want to not go in the sauna. But sauna is really good for detoxification, supporting lymphatics as well. Which even just exercise, like just regular, which again, you want to be careful.
Why wouldn't you want to go in the sauna? Isn't sauna going to relax you?
I don't know. I mean, I honestly can't say I maybe find the first 10 minutes relaxing, but then when I'm like heated up, after like 25, 30 minutes, I'm ready to get out of the sauna. So some people might relax, but again, it's because it's heating, it's increasing that heart rate too. So that's the main reason for that.
So let's get into nutritional supplements and herbs that can help manage thyroid conditions like hyperthyroid. So I've heard you talk a lot about bugleweed, which is a natural anti-thyroid herb.
Yes. So bugleweed is That's what I took when I dealt with Graves. I mean, I would have considered the anti-thyroid medication if the bugleweed didn't work, but when I attended some functional endocrinology seminars prior to being diagnosed, that's when I learned about bugleweed as well as motherwort, which is kind of like a natural beta blocker. So I took the bugleweed to help lower the thyroid hormones, and yeah, in my case, it did a wonderful job. I'd say probably like 75% of people that take it, it helps. Some people, it just doesn't work. But there's bugleweed, there's motherwort, like I said, which focuses more on the heart rate, the cardiovascular system. L-carnitine in higher doses helps to, that seems like it blocks the entry of thyroid hormone into the cell. And just a recent study came out on L-carnitine and selenium combined. August 2025, a study came out showing that not even a lot of each. Like there's earlier studies showing that you need 2 to 4 grams of L-carnitine to help to block the entry of thyroid hormone to the cell. And a common dose of selenium given by practitioners is like 200 micrograms, because selenium, there's a lot of research showing that could help with lowering antibodies by reducing oxidative stress. But there's a 2025 study showing that 500 milligrams of L-carnitine combined with 83 micrograms of selenium help to not only allow people with Graves, it was specific for Graves' disease, they were able to take less anti-thyroid medication, but then also, in addition to that, it led to their thyroid the thyroid antibodies lowering quicker compared to the control group. So the combination of L-carnitine and selenium, something to maybe consider also for from a symptom management perspective.
It's interesting because I've always found selenium to be really helpful for hypothyroid.
Yeah, well, it's for both, because again, it's more, but you have oxidative stress with both Hashimoto's and Graves, so it does make sense that for really either of those conditions, it could be beneficial.
Right. And what is the specific dosage of bugleweed? One of the things I've noticed with a lot of these herbal products is they don't always list the specific dosage, and there's often a combination, and they'll say proprietary blend of bugleweed, motherwort, lemon balm,
Yeah, that's a great question, because there are formulas like thyroid calming formula from Herb Farm that has the bugleweed, the motherwort, the lemon balm, and then it just says, like, I forget the dosing.
It has some kind of cactus as well.
A drop.
Is cactus beneficial?
Yeah, I don't know. I haven't learned. Again, I don't know why that's in there, because again, we know that the bugleweed, the benefits of bugleweed, motherwort, and then we didn't speak about lemon balm that has some mild anti-thyroid properties. But yeah, the cactus, I've seen, that's, I think, specific to the thyroid calming formula from Herb Farm. I think that's the one that has it. There's also
it's Herb Farm. Yeah,
because there's a few others that have a combination of the bugleweed, motherwort, lemon balm. But you're right, a lot of times they're proprietary blends. And what I tell people is the bugleweed's the most important. So if you're trying to lower thyroid hormones, you probably want to just take it separately. I mean, if someone's taking a combo and they're doing, it seems like it's helping, I'm not going to tell them to stop doing it. But if they're not taking anything, I'll say just take.
Do you know what the exact dosage of bugleweed is supposed to be?
So it depends on the person and it depends on the extract. So I took MediHerb bugleweed, which is a 1 to 2 extract, and I took 1 teaspoon twice per day, which is 5 milliliters twice per day. That's a common dose. Some people will take, some people only need maybe like half a teaspoon of that. If someone's taking Herb Farm, like Herb Farm is a 1 to 5 extract, so it's not as potent. So they might need to take more than they might have to take like 2 or 2.5 teaspoons multiple times per day. So really depends on the potency, but that's what I took. And that's usually I recommend the MediHerb bugleweed. It's, there's other ones. Herb Farm actually is good quality, I think. It's just the potency is lower. But that's also an option too. I mean, there's, as you can imagine, it's not as popular as like vitamin D bugleweed, where, if you go to a health food store, you might struggle to find bugleweed, because it's really more. How
many people have hyperthyroid? Do we know how many people in the population?
Well, Hashimoto's is like 8 times more prevalent, I believe. And that's, I think, the known causes. There's a lot of people who are misdiagnosed. And so I think every year there's around maybe 1 million new cases of hyperthyroidism, which might sound like a lot, but when you look at how big the population is, it's not a huge number, maybe like 1.2 million, the last that I saw.
Okay.
But yeah, so it's, I mean, again, so there, I mean, definitely enough to keep me busy, but compared to Hashimoto's, it's, yeah, not nearly as common.
Are there any other supplements that can be helpful?
I mean, vitamin D, we mentioned vitamin D for modulating immune system.
Yeah.
And well, I mean, you also mentioned from a symptom management standpoint, I think we covered it. There's also lithium orotate. You're probably familiar. Lithium carbonate is a medication that used for depression, not as commonly these days, but they realize it makes people hypo. But yeah, and then there's lithium orotate, which you can get over the counter, and that
which is also referred to as like nutritional lithium, and we use that a lot for mood disorders.
Yeah, so it could help certainly with that as well.
It's even been shown to help with brain function.
Okay. Oh, cool. Yeah.
Decreased risk of dementia.
Yeah. Oh, that's awesome. Yeah. So but yeah, like other supplements, vitamin D. I mean, omegas. If someone's not eating fish, they probably are deficient in omega-3 fatty acids, so they probably need to take an omega. I mean, I usually recommend probiotics to help support the gut microbiome. And then depends on the testing. I do like to do functional medicine. So we mentioned like adrenals, for example. If you do an adrenal saliva test or Dutch test, and if someone's showing issues with the adrenals, we'll give. I'll usually. I mean, of course, we're going to say also block out time for stress management, which is arguably even more important than taking the supplements. Make sure you get sufficient sleep, and which could be a work in progress in itself. And then, if we do GI map or another comprehensive stool test and we see H. pylori clearly positive, I'll put someone on an antimicrobial protocol for that. So some of it depends on the testing. There's definitely general recommendations, and then there's what do we see with the testing that we do.
Especially when we're looking for the underlying triggers.
Exactly. Yep. You got it.
If you're doing hormone testing, do you find other hormones are affected by hyperthyroid?
Yeah, I mean, it is pretty common for hyperthyroidism to affect the other hormones. And I mean, some women will even stop cycling, like when they're dealing with hyperthyroidism graves. Sometimes, I mean, not, I won't say most people, most women, but it's not uncommon where, we'll see someone with Graves or even sometimes a non-autoimmune hyperthyroid condition, and, they'll stop cycling for a few months until the thyroid hormones are under control. So yeah, it does affect the hormones. And I mean, yeah, just like if you look at a Dutch test, it also affects, you could see, which makes sense, like the Dutch test not only looks at hormones, but metabolites. And one of the things they'll look at is cortisol metabolites. And so you usually see elevated cortisol metabolites because it's like increasing the metabolism of cortisol. So yeah, there's definitely some patterns.
Meaning it's getting processed quicker.
Exactly. Yes. And like with hypo, it's the opposite. So if you do a Dutch test and you have overtly low thyroid hormones, you usually see like low cortisol metabolism. So yeah, it's
interesting. Another medication I've heard you mention is low dose naltrexone.
LDN. Yep.
LDN. What do you think about that?
I mean, I'm okay with it. It's, I can't say I love it or hate it. It's just another tool. Like it's, low dose naltrexone modulates the immune system, and it's kind of hit or miss. It doesn't always work. And it could take time for it to work. They usually start out with a lower dose and then gradually increase it. I mean, if it works, the benefit is that it's actually focusing on the immune system. And we mentioned numerous times, Graves is autoimmune, same thing with Hashimoto's. So it's not just focusing on the thyroid. The downside is just like everything else, like the medication and other things, some of the other things we discussed, it's not addressing a cause and a problem. So if someone's on LDN, it might actually normalize the thyroid antibodies, which sounds great, But if you're trying to address the cause of the problem, you might not know if other things you're doing are working because you're taking the LDN. So it's kind of like with the methimazole, the anti-thyroid medication, it's lowering the thyroid hormones, but it's not normalizing the antibodies. So at least if someone's on methimazole, you could still look at that TSI and if they have other antibodies. But if they're on the LDN and the antibodies are normal, you don't know, is it due to the LDN or is it due to some of the other things that you're doing? And yeah, so that's where it could get challenging.
Right. Great.
Yep.
So I think those are the questions that I had prepared. Anything else you want to tell our listeners and viewers about?
I mean, you cover, you asked a lot of good questions. We covered a lot. I mean, the biggest thing is, there's a few big things. I mean, you want to be safe with managing the symptoms.
So you're going to have a lot of patients or having seen an endocrinologist who's telling them that maybe they need to go on medication or they need to, have some of these other treatments. It must be tricky managing some of these patients who are worried. Do I need to do radioactive iodine? Do I need to get surgery?
Yeah, I mean, definitely it is challenging because their endocrinologists have the strong belief that they need this and could be very convincing and can make it very scary for the patients. And it could be scary. I mean, you hear things like thyroid storm, which does happen, right, where, it's a medical emergency and most people have a thyroid storm. They do okay, but still, is it possible that, people can die? I mean, bad things can happen, but that's why I was saying you want to be safe. That's the number one thing, is being safe. And if it means taking the anti-thyroid medication, so be it. Again, like, I'm not opposed to the medication. There's a time and place for that. Again, if someone's not taking it and they're trying the herbs or they're trying the natural agents like L-carnitine, and if that's helping, great. But if not, and you need to take the medication while addressing the cause, that's fine. So my goal is not to fight with the endocrinologist. Obviously, we have different goals. Their goal is just to, give the meds. On the conservative side, give anti-thyroid medication for a year and a half, 2 years, and pray that the person goes into remission, which is usually temporary because they never did anything to address the cause of the problem. On the aggressive side, radioactive iodine thyroid surgery, so when they work with an endocrinologist, it's not, I wouldn't say it's real. I mean, sometimes it's challenging because they're anxious and they're scared initially, but most people who are working with me, they've read my books, at least one of my books, they're familiar with my podcast. So it makes sense that, hey, this is more of a thyroid condition. More of an immune system condition. So why am I going to remove my thyroid or, nuke my thyroid? It makes sense. Yeah, let's focus on the immune system. And like I said, you could always get radioactive iodine, you could always get thyroid surgery, but so many people over the years have expressed regret because they jumped into it and they didn't even know that there was a possibility. Right.
Once you remove your thyroid, there's no possibility of doing anything else, no natural treatment or anything else. So what you're saying is try a natural approach if you're so inclined. If you're on the medication, you can still try the natural approach to get to some of the underlying root causes and get the condition under control. And if that's the case, then over time, you may be able to wean yourself off with the help of your endocrinologist from the medication. And like yourself, continue to lead a healthy life without taking medication, without having surgery or radiation, just by paying attention to diet and lifestyle and all the natural things that help balance out our bodies and our physiology and our immune system.
Yeah, I couldn't have said it better. So yeah.
And not only do you overcome your hyperthyroid or manage your hyperthyroid, how do you like to look at it? Do you feel like you've overcome hyperthyroid or you feel like you're managing it?
Oh, no, I definitely overcame it. And I don't like to use the word cure because there are genetics involved, but to me, managing would be like if I was still taking bugleweed, which I haven't taken since 2009. Right. So if I was taking that to keep my hyperthyroidism in check, then to me, that's managing it. But once you're not relying on any medication or supplements to keep the thyroid hormones in check. To me, it's reverse. The goal is really to reverse the autoimmune component and to reverse the hypothyroidism.
What kind of TSH do you typically run, say?
Typically like 1.1, 1.2.
Okay. So on the lower end, but not hyperthyroid.
Correct. Yeah. And I mean, if someone's TSH is like 0.9 or 0.8, I mean, again, I like to see it above 1, but if that everybody's normal is different, just like, I like to see it between 1 and 1.5. If someone's like 1.7 and that's where it is like all the time, like 1.7, 1.8, but it's not getting higher, not getting lower, and they're not on anything. I mean, I'm not going to try to force it and say, oh, we need to get it within that, 1 to 1.5. So mine runs like lower, like above 1 typically, but on the lower side. And I mean, if it was a little bit lower, I wouldn't get too, if it kept on decreasing, now that's a problem. But, but that's why I also monitor it at least once a year, if not multiple times per year. And that includes the antibodies, because the antibodies will typically change before the thyroid. So, that's the backwards thinking of most medical doctors. They just look at TSH. And then if that's out of range, then they'll start looking at other things, including maybe the antibodies. But some talk about predictive antibody testing, which would be great to look at antibodies first, since, again, especially Hashimoto's, you could have elevated TPO and or thyroglobulin antibodies for like 5, 10, 15 years and have a normal TSH, or at least normal within the lab range. It might be higher than optimal, but where the doctors are still ignoring it.
Right. And this is where functional medicine can really potentially shine in preventing a lot of these conditions by picking out some of these patients who have these autoimmune conditions. And it's sort of like an iceberg under the water. And we don't really need to wait until it rises way above to try to take corrective action and bring some balance to our system. But we have to be able to recognize it.
Agreed. Yeah, 100% agree. So, I mean,
great. So, how can listeners and listeners and viewers find out about getting in contact with you and getting your books?
Yeah, thank you. Thanks, Dr. Ben. SaveMyThyroid.com is I have actually a few websites. I came out naturalendocrinesolutions.com is my original website from 2010. And then when I came out with the Save My Thyroid podcast, which of course you've been on a couple of times now, and SaveMyThyroid.com, Save My Thyroid came out in 2021, the podcast. 2021. And so I'm like, SaveMyThyroid.com is a lot easier to remember than naturalendocrinesolutions.com. So I still have both websites are pretty active, but SaveMyThyroid.com is where you could find like the podcast episodes, naturalendocrinesolutions.com, more of the blog posts and articles that I've written in the past. And my books, you can find all three on Amazon. That's probably the easiest way. Just search Eric Osansky, or if you search hyperthyroidism, you probably find the two, since there's not a lot of books on hyperthyroidism. And those, I mean, work with Dr.EricOsansky if you want to, if anybody's interested in working with me. But I guess those are the main. Actually, one other thing I just came out with too that I'll plug here. I have a Healing Graves Naturally school community. I don't know if you've been with School, the platform School, SKOOL. No. It's out off of Facebook. Right now we have about 330 something people in there, and it's pretty engaged. I mean, just
is this like a group on Facebook, or what is it?
It's not. It's off of. It's kind of like similar to a Facebook group, but it's not.
So it's not part of Facebook.
But it's not on Facebook. It's off of Facebook, so you don't have to deal with the rules of Facebook. And,
right.
And again, it's smaller. I do have a few. Like I have a hyperthyroid group on Facebook that's 25,000 people, which is really, I kid around. I say it's great for my ego, but it's really too big. Like where, how Facebook works. If you post something, only a small percentage of those people are going to see it in the first place. But yeah, school is cool. So savemythyroid.com/heal Graves' disease. And that's to join the free school group. And yeah, so those are the best ways to find me.
Is that an educational thing, the school group?
Yeah, I mean, it's a few things. You actually, once you join, there is a training, the Graves Survival Roadmap training, where just I talk about my process and kind of a lot of things we spoke about here, but in greater detail. So that's a free training. So they do get education. Once a month, there's a free group call with one of my nutritional health coaches. We call it the Hyperthyroid Healing Diet calls. And then, of course, there's the community aspect. I try to encourage engagement. And so far, we had a challenge, a Find Your Graves' Disease Triggers Challenge not too long ago, and that went really well. We had that's how I grew the school group. We had initially like over 700 people join the challenge. Not all those people joined the school group, only like 200 plus joined the school group. But whenever I have future live events, it'll be in that group, in that community. So yeah, if you have Graves or even a different type of hyperthyroidism, there are people in there with like toxic multinodular goiter, subclinical hyperthyroidism, and but that's what it focuses on, is just hyperthyroidism, and so far it's been going well.
Great. Excellent. Thank you so much, Eric.
Yeah, thanks, Ben. Great chatting with you as usual.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.